So before we get started on med school interviews and going into the nitty-gritty details, the main thing I want to start off with is the mindset you should have as you're preparing for your med school interview or even your residency interview or later on. But the main mindset, there's a few things I want you to remember. These are quotes and these are general mindset approaches. One is that you only need one interview to get in. I personally had applied to over 15 schools and I only got one interview, and really that's all it took for me to now end up where I'm at. So I know in the pre-med stage, a lot of people compare, hey, he got invites at 14 schools, he got invited at 10 schools. I know countless students who've gotten numerous interviews but didn't get accepted at all. And I've known people, like myself included, who got one interview and got into med school. So really, don't limit yourself. Don't kind of downplay the opportunity that you get, even if it's just one interview. If you have multiple, congratulations. But that doesn't mean that you're going to be successful. Just prepare yourself just as much, because yes, more opportunities, more interviews, higher likelihood, but you still want to prepare for it. So the second thing I want you to remember is that preparing to the best of your ability and then letting go of the outcome is probably the best mindset you can take towards this, because again, med school acceptance is a black box. There's a lot of different moving parts into it. And I've been involved in the medical admission process, both as an applicant and then as a reviewer, as well as a chief resident down the line. So I know exactly what goes into the process. And let me tell you, it is a little bit of a black box. We've had Olympic level athletes that I've reviewed their profiles and they've not gotten an interview. And you would think like they're Olympic level athletes, they would get an interview or they would get accepted. But that does not mean that they'll get accepted. Different schools have different criteria and different weightings of the criteria. Sometimes you can find this on the student doc boards or pre-med 101 forums. You can find some inclinations of like what schools value what. The med schools in Canada value different things based on what school you go to. I went to Queen's, which really valued community, family medicine, and that kind of aspect. Whereas if you go to University of Toronto, it values more research and academic production is kind of what it really values and prides itself in. So it just depends on where you go to. Third thing, there is such a thing as too much research, but there's no such thing as too much practice. And this is something I want you to really drill in, because probably the one single distinguishing feature between people who are successful in their interviews and people who are not is practice. And I'll talk a lot more about this, and there's different levels of practice, but I'll get into that a little bit later. But again, just remember these little mindset tricks whenever you come up against any negative thoughts, any self-doubts. Just want you to remind yourself about these.